Good morning. My name is Bill Doyle. I'm Novocure's Executive Chairman, and I am pleased to formally welcome you to Novocure's 2020 Virtual Research and Development Day. Novocure is a global oncology company working to extend survival in some of the most aggressive forms of cancer through the development and commercialization of tumor treating fields. We anticipate readouts from key clinical trials over the next few years. Our plan today is to review the extensive body of tumor treating fields research conducted over the past 2 decades. We will also introduce areas of ongoing research intended to identify optimal use of tumor treating fields and to improve the predictive value of the scientific evidence generated. Additionally, we are excited to highlight growing interest in tumor treating fields from across the global scientific community as we advance our collective mission to extend cancer survival. We believe we are in a virtuous cycle of execution and innovation at Novocure. Our established commercial business treating patients with GBM and MPM continues to drive revenue growth and financial strength, which enable us to fund significant, increasing investments in R&D. The clinical evidence generated informs potential opportunities to increase our addressable market through the expansion of treatable cancers and to increase efficacy through product innovation. Today, we will focus on the research and development activities intended to propel further growth in this self-reinforcing cycle. We have made incredible progress since our last R&D Day in 2016. We have grown R&D investment by more than 160%, with $112 million invested in the last 4 quarters alone. We have published promising phase 2 pilot data in 3 additional solid tumor types, resulting in a humanitarian device exemption FDA approval for malignant pleural mesothelioma and the initiation of phase 3 pivotal trials in lung cancer, pancreatic cancer, and ovarian cancer. We've expanded our clinical pipeline to investigate tumor treating fields in liver and gastric cancers. We have seen a steady increase in publications citing tumor treating fields, and we believe we are at the point where Optune has clearly established its central role in the treatment of GBM. As proud as we are of the scientific progress made over the last 20 years, and as clearly as we understand the ability of tumor treating fields to disrupt cancer cell division, we believe we're only beginning our potential to impact oncology. Ongoing research is informing the optimal use of tumor treating fields and improving the predictive value of scientific evidence generated. Our existing pipeline programs create the potential to extend the reach of tumor treating fields therapy to many more cancer patients, with multiple data readouts anticipated over the next few years. Interest is growing across the global scientific community to demonstrate tumor treating fields' effect in multiple solid tumor targets and in combination with radiation and additional chemotherapies and immunotherapies. All of the research and development underway, both at Novocure and across the scientific community, build upon and enrich the tumor treating fields ecosystem. Translational research, clinical development, and product innovation programs drive our opportunity to expand the approved indications for tumor treating fields therapy. Research grants support in vivo, in vitro, and other preclinical projects conducted by interested scientists around the globe, and investigator-sponsored trials further refine our understanding of tumor treating fields' optimal use in the clinic. All of these efforts are ultimately in service of patients as the entire ecosystem strives to extend survival in some of the most aggressive forms of cancer. Our patient-forward mission is clear. This morning's agenda will focus both on translational research and on clinical development with 2 opportunities for live Q&A. We will feature 6 leaders from Novocure's R&D teams and 5 external KOLs engaged in tumor treating fields research programs. Translational research presentations will focus on how basic biology, dosimetry, and product development programs can address clinical unmet needs. Clinical presentations will highlight potential combinations with chemotherapy, immunotherapy, and radiation therapy. Throughout the event, you will have the opportunity to access a virtual exhibition hall featuring additional tumor treating fields resources. We hope you leave today as confident as we are in the potential of the tumor treating fields therapy platform. With that, I will hand the program to Dr. Yuri Weinberg, Novocure's Chief Science Officer, who will discuss tumor treating fields' mechanism of action.